It begins quietly with a single, unassuming mark on the skin, something you might overlook or dismiss as harmless. But lurking beneath that tiny spot is a battle brewing, a life-altering struggle that will test the limits of science, the resilience of the human spirit, and the very boundaries of hope. Skin cancer isn't just a disease. It's a silent invader waiting for its moment to strike. This is the journey through its many faces, the hidden warning signs, and the relentless fight to reclaim life. An exploration of a foe that thrives in shadows and the courage it takes to bring it into the light. What is skin cancer and what causes it? Skin cancer, a silent but relentless adversary, doesn't announce its presence with pain or discomfort in its early stages. Instead, it often begins as a small, almost unnoticeable blemish, perhaps a spot that appears harmless at first glance, or a mole that seems innocuous. But beneath the surface, changes are underway. As cells begin to grow uncontrollably, transforming a simple spot into a serious threat. The nature of skin cancer. At its core, skin cancer is the unchecked growth of abnormal cells in the skin's layers. Unlike healthy cells, which divide and replace themselves as needed, these rogue cells ignore natural boundaries and start multiplying without stopping, pushing aside healthy tissue. Often, these changes take place in areas of the skin most exposed to sunlight, like the face, arms, neck, and hands. But even areas typically shielded from light aren't completely immune. In rare cases, it can appear on palms, under the fingernails, or even on the soles of the feet. 3 main types of skin cancer exist, each with unique characteristics. The most common type, basal cell carcinoma, usually grows slowly and stays confined to one area, but if neglected, it can become deeply invasive. Squamous cell carcinoma, on the other hand, can spread more aggressively if untreated. Finally, melanoma, the rarest but deadliest form, develops in the cells responsible for producing pigment. Melanoma spreads quickly, often reaching distant organs, making it critical to catch early. What causes skin cancer? The story of skin cancer is rooted in exposure to the invisible, dangerous rays of sunlight. Ultraviolet, UV, radiation. Most people associate sunlight with warmth, vitality, and the bronzed glow of a tan. But within these rays lie UVA and UVB, invisible forces that slowly damage the DNA and skin cells over time. This cumulative impact creates mutations that, if left uncorrected, prompt cells to replicate uncontrollably. However, sunlight isn't the only cause. In recent decades, the pursuit of year-round tans has led to widespread use of tanning beds and artificial sun lamps, both of which emit UV radiation at levels far higher than natural sunlight. Studies have shown that a single session in a tanning bed can significantly increase the risk of developing skin cancer, especially among young people whose skin is still highly sensitive to damage. While UV exposure is the primary culprit, other factors come into play as well. Genetic predisposition, for example, plays a large role. People with fair skin, light eyes, and blonde or red hair are more susceptible, as their skin lacks the same levels of melanin, the natural pigment that provides some protection against UV rays. Family history also raises the stakes, as does a weakened immune system, which is less capable of detecting and stopping abnormal cells before they grow out of control. In short, the causes of skin cancer are a complex interaction of environmental exposure, genetic makeup, and individual habits. It's a story of invisible dangers that many encounter daily, often unknowingly. Understanding the origins of this disease, the everyday risks, the dangers hidden in sunlight, and the often underestimated power of genetic predisposition is the first step toward awareness. It's a call to notice the signs early, to see beyond what meets the eye, and to recognize that skin cancer can affect anyone, no matter their age or background. This journey into the nature and causes of skin cancer is more than medical knowledge. It's about being alert to the unassuming clues on our skin, clues that tell a deeper, sometimes life-altering story. Types of skin cancer, symptoms, and diagnosis. Skin cancer is not a single, uniform enemy. It wears many faces. Each type carries its own behavior, its own way of spreading, and its own level of danger. Recognizing the differences between these types is like knowing an opponent in a fight. It gives insight, strategy, and, most importantly, a fighting chance. The three phases of skin cancer. The most common and least aggressive form, basal cell carcinoma, is the quietest of the three. It begins as a small, pearly bump or a reddish patch, often ignored as just another skin change. This type rarely spreads beyond the skin, yet it slowly digs deeper, damaging nearby tissue as it grows. Left unchecked, basal cell carcinoma can cause significant local damage, especially when it appears near critical areas like the eyes or nose. Then comes squamous cell carcinoma, a step up in severity. This type often begins as a rough, scaly patch or a wart-like bump. Unlike basal cell carcinoma, squamous cell carcinoma is not content to stay put. It has a tendency to spread, first to nearby lymph nodes and, in advanced cases, to other organs. The stakes are higher here, and the urgency to detect it early is even greater. But the most formidable of all is melanoma. Known as the silent killer, melanoma starts in the melanocytes, the cells responsible for skin pigmentation. It can begin as a dark spot, irregular in shape and color, or an existing mole that suddenly changes in size, color, or shape. Melanoma grows quickly, and once it reaches deeper layers of the skin, it spreads to other organs, making it incredibly lethal. It is the form of skin cancer that leaves families mourning loved ones taken far too soon. Symptoms: what to watch for. For each type, the body sends warning signs, small but crucial clues that often go unnoticed in the busyness of everyday life. An unusual bump, a new mole, or a rough patch that refuses to heal may all be early signs of skin cancer. In the case of melanoma, one of the most important tools is the ABCD rule: asymmetry, border irregularity, color variation, diameter greater than 6 millimeters, and evolution or change over time. Each of these characteristics highlights something abnormal in the skin, a possible alarm from the body. Beyond visual signs, there are also sensations. A spot that itches, bleeds, or feels tender to the touch can be the skin's way of drawing attention to something amiss. These symptoms may seem minor, even harmless, but skin cancer has a way of hiding in plain sight. Awareness and attention to these details can mean the difference between catching it early or facing a far greater battle down the road. Diagnosing the hidden threat. The path to diagnosis often begins with suspicion. A person notices a new mark on their skin, or perhaps a loved one points out a mole that wasn't there before. The first step is usually a visit to a dermatologist, who will conduct a thorough skin examination, searching for any abnormal spots. If something suspicious is found, a biopsy is often the next step. With a quick, minimally invasive procedure, a small sample of the suspicious skin is removed and sent to a lab for examination. Under a microscope, a pathologist can determine whether cancer cells are present, and if so, identify the type and stage. For those with advanced symptoms, additional tests may follow. Imaging scans, like CT or PET scans, may be recommended to check if the cancer has spread beyond the skin. Lymph node biopsies are sometimes done to detect spread to the lymphatic system. Each test brings a new layer of understanding to the diagnosis, allowing doctors to create a roadmap for treatment. A window of opportunity. In this journey of diagnosis, there exists a critical window, an opportunity to catch the disease before it becomes life-threatening. This window, however, is often small, and it can close quickly. Recognizing the symptoms, acting early, and following through with diagnosis can transform a deadly outcome into a manageable condition. It's a race against time, but one that can be won with vigilance and action. Skin cancer may wear different faces, but the underlying message remains the same. Pay attention, know the signs, and take action without delay. For many, this knowledge becomes a lifeline, an anchor in the fight against a foe that thrives in silence. Treatments and medications for skin cancer. Once the enemy is identified, the journey to healing begins. Skin cancer may be a formidable foe, but it is not undefeatable. Each form of treatment, every medication, represents a path to recovery, a chance to restore hope, life, and health. The art of surgical precision. For most types of skin cancer, the first line of defense is surgery. This is not merely an operation but an art, carefully executed to remove every trace of cancer while preserving as much healthy skin as possible. In the hands of a skilled surgeon, even an aggressive basal cell or squamous cell carcinoma can be excised, layer by layer, until only healthy tissue remains. Known as Mohs surgery, this meticulous process is often used for cancers in sensitive areas, such as the face, where preserving appearance and functionality is crucial. Mohs surgery offers patients a ray of hope. It has an impressive success rate, especially when the cancer is caught early. For those who face surgery, it may be daunting, but it is also a moment of triumph. It is the body reclaiming what cancer tried to take, a physical and emotional victory. Non-surgical treatments, fighting with light, cold, and medication. Yet, not all battles are fought with the scalpel. For smaller or superficial cancers, non-surgical treatments can be highly effective. Cryotherapy, for example, uses extreme cold to freeze and destroy abnormal cells, eliminating cancerous tissue without an incision. Photodynamic therapy, meanwhile, harnesses light and a special drug applied to the skin to kill cancer cells, offering another option for those looking to avoid surgery. Then, there are topical creams, medications that bring the fight directly to the cancer cells. Applied to the skin over a series of weeks, these creams are a non-invasive alternative that can treat small, early-stage cancers, especially basal cell carcinoma. Medications like imiquimod work by stimulating the immune system to attack the cancer cells directly, while 5-fluorouracil targets the DNA of the abnormal cells, blocking their ability to grow and spread. These treatments offer patients freedom, the possibility of healing without the scars of surgery. Immunotherapy and targeted therapy, turning the body into its own defender. For the most aggressive cases, such as advanced melanoma, the body's own immune system is called to action. Immunotherapy, a revolutionary approach, turns the immune system into a powerful weapon against cancer. Drugs like pembrolizumab and nivolumab strengthen the body's defenses, training immune cells to recognize and destroy melanoma cells. This approach has transformed treatment, turning what was once a near-certain death sentence into a treatable and even curable condition for many patients. In cases where melanoma has spread, targeted therapy offers another lifeline. This treatment focuses on the specific genetic mutations that drive melanoma growth, using drugs that turn off the pathways that allow cancer cells to thrive. It's a precise and tailored approach, one that offers hope where traditional treatments might have failed. The role of chemotherapy, when all else fails. While chemotherapy is not as commonly used for skin cancer, it remains a critical tool in certain cases, particularly when other treatments are no longer effective. Delivered either through or as a topical cream, chemotherapy attacks cancer cells aggressively. It may be physically demanding, but for those in advanced stages, it can offer a path forward, a lifeline to buy precious time, or even to achieve remission. Hope and healing, the journey to recovery. Every treatment, every medication brings with it a renewed sense of hope. For each patient, the journey is uniquely their own, yet they are united by a common goal: survival. The process may be challenging, with physical and emotional highs and lows, but the possibility of healing keeps them going. For those who conquer skin cancer, the scars left behind, whether physical or emotional, are symbols of resilience and strength. They are reminders of the fight they faced and the victory they earned. As they look to the future, these survivors carry with them a powerful story of endurance, a testament to the power of modern medicine and the strength of the human spirit. Skin cancer may be a ruthless adversary, but with every treatment, every breakthrough, the odds grow ever more in favor of survival and recovery.